And how we all handle this will determine how far we go in curtailing this.
Yes, that is right.
Is it something that the medical council, there is one, should be looking into as well? Because in a case where you have people dying, I remember the diplomat, the UK diplomat who came in to Nigeria through the airport and collapsed on the queue, and people were afraid to touch initially because they thought it was Ebola. Turned out, the suspicions of heart attack. We've also heard stories of that. We're discussing behind the scenes, and it would seem that in some people's lives, in just less than how many weeks, at least 3 people are reported to have died over something that was totally not Ebola. Possibly didn't even have the symptoms of Ebola. One was of a heart attack. The second was sickle cell anemia. And it would seem that these people are dying needlessly for something that medical practitioners can actually do something about. Is it something that you think that the medical council can take on and, gives 10 warnings to the people involved?
We are exploring all options on this. We are looking at the fact that we need to convince people. It's part of the discussion I was having with somebody. There's something called masterful inactivity, in which even if you do take the patient in, you might not do anything. You just walk in and out as if you're doing something. But we really need to do something. So we need to keep on convincing our health workers. It's part of our planning, ramping up this response to try and make sure that we train as many people as possible about the things they need to do. We are looking at getting hospitals that we use as triage, in which if you have a case, you can actually send them to these hospitals and they can help us sift to see if these people are actually having Ebola. But at the same time, how many are we going to send in there? Because these symptoms are just the normal symptoms that occur in a variety of diseases. They're not peculiar to Ebola. I was reading in the news yesterday that there is a cholera outbreak gastroenteritis outbreak in Sokoto. If this had happened in Lagos, I'm sure all the 40 people that were being treated would be labeled Ebola cases. And simple giving them rehydration, which probably have saved these people, wouldn't have been done, and they would have died. So I think we need to go beyond our fear. We need to conquer our fear. And I think that is the appeal that I'm making to my fellow health workers, that over and above Ebola, there are a lot of diseases out there that are killing people, and we need to be able to stem the tide.
And one of the things that, you did mention the visit of Mrs. Thomas Greenfield to Nigeria, and even the Ebola Center. She did make an appeal when she did visit the Minister of Health that Nigeria needs to help out its neighbors. Is this something that, you've heard muted in the circles of those treating? Because we have been told that as a country, even after we've taken care of our own cases, we cannot be out of the woods until the other West African nations are clear. Is it a perspective we should also be exploring?
Yes, I think the minister is actually exploring those options, and we will try as much as possible to help. Like you rightly said, if it doesn't stop out there in other countries, we are not safe. No matter how much surveillance we do, no matter how much port of entry screening we do, people can still come in without having symptoms and then develop symptoms here. So until we also be our brother's keepers and try to stop this epidemic that's out there, we are not really totally safe. So I'm sure the minister is actually looking at all options to try and see what we can do to help.
Because part of what raised that concern was the visuals, images that we saw emanating from Liberia, how I think it was a man who was infected with it and then he hit the streets going about his normal duties away from that, and that's the clip actually, and everyone thought, wait a minute, jaws were dropping at the time. So he went about his duties, and those officials with their PPEs trying to appeal to him to get back to the quarantine center and not run the risk of infecting other people. And when this broke, lots of people were surprised. And so that's why the concern is also there, that we also have to keep tabs on what's going on in those countries. In fact, keep the communication lines on so that we also be more aware and cautious on how we handle our own here.
Yes, I quite agree with you. And if you look at that picture, that actually really puts in perspective what I was saying about our health workers. You could see the MSF worker in there. He was just in his gloves. He wasn't putting on the PPE. And yet, he was one of those who was actually going after the Ebola patient. And that, for me, actually encapsulates what we talk about with our health workers. Yes, again, we need to keep on keeping tabs. We have to help. If we do not help, it is going to still come for us. We cannot, by any stretch of imagination, stop anybody from coming in. People will find a way. So the only way to actually protect ourselves at the end is make sure that this raging epidemic out there stops. So we will try as much as possible once we are done with what we're doing here, because again, we are not out of the woods either. We still have ongoing contacts that we are following. We sincerely hope that we do not get many cases out of them, so that we can now have free health workers who we could probably deploy to other places to help out. But I'm sure the federal government is thinking along those lines, considering that this is an ECOWAS thing. There's been all forms of coordination at that level to actually see what the countries within ECOWAS can do.
Hey, ECOWAS thing, and ECOWAS diplomats have helped to to bring it in and also spread it to other states. We'll see how it eventually pans out. But how would you rate our levels of hygiene? Are we beginning to let it slip, or are we ramping it up? And then add to that what we're seeing on the front page of The Guardian here: Reps Lagos may review schools resumption date over virus.
I think our level of hygiene is improving. People are much more aware that this hands, like I keep on saying, is the problem. It is not the hands per se, it is what we do with it. Mm-hmm. And so if you try as much as possible to keep the hands clean, then you'll probably be doing a lot to prevent getting this. And it's not only Ebola, it's actually a lot of things. I mean, cholera, typhoid, all sorts of infectious diseases. You get them through your hands. We always call them fecal-oral routes, which simply means it's something that comes out of the other end that gets to your hands, that get in front. So I think that is on. The decision about resumption of schools, it's something that it's ongoing. Based on certain factors, I think that's why the federal government took those decisions. Mm-hmm. And if the circumstances change, I'm sure they will also take decisions that are in the best interest of everybody, really.
All right, we'll have to wrap it up. Dr. Kayode Oguntimehin is the Permanent Secretary, Lagos Primary Health Care Board. Thank you for coming on this morning, and well done.
Thank you.
All right, and well done to every other person out there also doing what they can to ensure that we all contain this and help our neighbors as well with this. We'll be back in just a moment. Join us again.